we're going to start with proper techniques for lifting, and Dr. Hesselschwart here is going to demonstrate the proper techniques. But with the lifting, you want to keep the box as close to midline as you can, is in front of you. You want to get a nice firm footing. You want to make sure that your feet are about shoulder width apart with the stance. Bend with your knees in the hips instead of the waist, and tighten up your stomach muscles. Use the legs to lift with, and keep the box close to the body. And keep your back straight and keep your back upright as you lift.
Okay, next what we're going to do is we're going to take some approaches, some proper strategies to do their work. Of course, a lot of people that work in the factory setting have issues with their wrists, with your elbow. So first of all, we're going to look at the wrist area. First stretch we're going to do is called Stretch Armstrong. And Dr. Lorenz is going to be our model here. So what you're going to do is start with your arms straight out with your palm down, where you're going to flex your fingers out, and then you're going to use your other hand to kind of gently push down on the hand, stretching those extenders, okay? And what you're going to do is kind of hold that for 20 seconds, and then do that 2 or 3 times a day. Second stretch we're going to do is called the prayer stretch. What we're going to do is just simply put your hands together, kind of in a prayer type formation. Again, we're going to hold this for 20 seconds as well. Next we're going to do is what's called the spiders, doing push-ups. Exactly what you're going to do is kind of take your palms together, push against the tips of your fingers on out. Last, what we're going to do is for fatigue in the hands is called the shake. And what you're going to do is simply just shake out your wrists, shake out your hands for about a minute or two at every hour. Next, what we're going to do is we're going to concentrate on the low back area. Obviously, a lot of people in the factory setting, you have issues with low back pain. So the first one we're going to do is just called the kneeling lunge. And simply all you're going to do is kind of step forward, and that's just going to stretch out the abdominal area, okay? Next we're going to do, and you can do this seated or standing, but we're going to show this in a standing position, is just a forward flexion stretch. Just slowly stretching forward, stretching out these low back muscles. Don't bounce at the end of the stretch, just slowly go down and hold and come back up, okay? Next we're going to do is we're going to move into the shoulder girdle. First one is going to be called the adduction stretch, and we're going to be concentrating on the posterior muscles of the shoulder. Simply just going to be pulling the arm across midline and holding it for about 10-15 seconds and go back and forth with each arm. Next is going to be called the door jamb stretch, or you can just find a surface where you can kind of hold on to, and we're going to be working on the anterior aspect of the shoulder girdle. And what you're going to do is just kind of hold and just kind of pull forward, stretching out those muscles in the anterior aspect of the shoulder as well. Next, we're going to work on the upper back and the posterior neck. This is simply just called a 45-degree flexion stretch. What Dr. Lorenz is going to do is just kind of pull forward and kind of over at a 45-degree angle. That's going to concentrate specifically on the posterior muscles of the neck on that side. Last we're going to work on are the feet. Obviously, standing on hard surfaces for matters of time, we're going to have issues with the feet. So, the first one that we're going to do is called the towel stretch. You can grab, you don't have to necessarily have a towel, but something that you can kind of rope around the bottom of the foot, and you're simply just going to pull the front of the foot towards you. Hold that stretch for about 10 or 15 seconds. Kind of go back and forth with each foot. That's going to help stretch out the arch, the bottom of the foot, and then also you're going to feel some stretch in the posterior leg as well. Next is the stair stretch. You can find an elevated surface, or even, as Dr. Lorenz will show you, can do it against the wall. Again, you're just going to plant the forefoot against the wall and just add some pressure down. That's going to help stretch out, again, the bottom of the foot and also the posterior leg. Last but not least, we're going to do, for plantar fasciitis, the tennis ball stretch. What you simply do is very simple. You have a tennis ball or maybe a golf ball or something like that. You just put on the floor, and all you're going to do is just kind of roll the bottom of your foot right over top of the ball. And what that does is helps relax, breaks up some adhesions in those muscles in the bottom of your foot.
As far as proper footwear goes, there's a lot of pros and cons to footwear, but the problems that we normally see here at the office with foot problems is achy feet, blisters, bunions, calluses, corns, flat feet, fungal infections, high arches, plantar fasciitis, which is a soreness in the arch of the foot. And it's important to take care of the feet, because if the feet give you problems, you feel sore all over. We can get you more comfortable shoes. Stretching regularly is going to help to keep your feet from getting sore, as well as proper support. The shoes should be comfortable and shouldn't rub or fit too tightly, leaving plenty of room for the toes in the front to move around. Chiropractic care, we do some chiropractic care to make sure that the alignment in the foot is proper, but also we do some supporting with the insoles of the shoes. But you want to keep the feet properly aligned, and so that will reduce the foot fatigue. The orthotic inserts can provide the feet with necessary support and act as shock absorbers, and also supporting the arches. It helps for those that have flat feet or are working on a hard surface like the concrete. Some of the things to look for when buying footwear is that the shoe must grip the heel firmly. There must be room up in the front for the toes to move around, and you want a low wide base heel. And flat shoes are generally recommended for being on concrete. If you get a pair of shoes, if you're buying a pair of shoes, generally you want to do it later in the day or after work, because the foot usually will swell a little bit and the foot will sometimes be a little bit larger. So if you fit the shoe at that time, that's the best time to buy your shoes.
Next, we're going to discuss some wrist issues. Okay, working in a factory where we are doing a lot of fast work, a lot of times workers get issues with pain in the wrists, pain in the elbows. First, we're going to look at some wrist brace options for, let's say, possible carpal tunnel syndrome or just general pain in the wrist. First is just a very general wrist brace. It's going to just wrap around the wrist joint and add some support. As you can see, it's kind of a universal brace where almost anybody can use it. It's going to add some support to the wrist without really limiting all the motion. So you can still do all those motions that you need for work. Next, we're going to go to more of a splint. So somebody that has a serious wrist injury or even maybe post-operative after a carpal tunnel surgery. This is designed a little bit more where it has a splint actually manufactured into the brace itself. And the splint area is actually here, if you rotate your palm up, here. So what that's going to do is going to limit the flexion of the wrist, okay? But it's still going to give support to the whole wrist area. So in regards to wrist sprints, they must be, try to make sure that they're comfortable, washable, durable, and easy to remove. Keep the wrist in a neutral position. The wrist is generally in a neutral position when you're holding a glass of water with the thumb in line with the forearm. So that'd be the position you want to be in when you put the wrist brace on. Next, we're going to look at the elbow. Tennis elbow, which a lot of people have issues with, is just pain in the lateral aspect of the elbow, okay? So what happens is the extensor muscles, which are located here, which kind of rotate or extend our wrist, become irritated and you get pain in the outer elbow. To help with this, there are braces designed to take pressure off of the tendons supporting these muscles. What we're going to do is we're going to take the pain point, find that, and what you're going to do is bring the brace up about 2 finger widths just below, and that's where you're going to place your brace. And what that's designed to do is help not only support the muscles and the tendons of these muscle groups, but also it's going to take pressure off those tendons and muscle groups as well. And simply, it's just another universal brace, very easy to put on, very easy to operate, and fits almost any arm.